It's another day with the physicians where your health is our business.
Growth spot to end. So you are not going to take some drastic measures. But a 10-year-old coming, pressure is high. But also to know that it's not only when your pressure is high that you have glaucoma.
Sugar, and I don't know about any other one, but what do you know?
You're welcome back to the Training Culture of your regular program.
PTSDs can get help. Again, it's not for psychotherapists alone.
Exactly.
Individuals can begin to equip themselves with the right knowledge on how to, offer basic talk therapy.
Down syndrome is a genetic condition caused when abnormal cell division results in extra genetic material from chromosome 21. It causes a distinct facial appearance. It causes delayed development, learning disability, short stature, or speech delay in a child. The condition cannot be cured, but it can be managed appropriately. We will be discussing Down syndrome on your Health TV talk show, The Physicians. Just stay tuned. Welcome to your regular Health TV talk show, The Physicians, where your health is our business. Today we're talking about Down syndrome, a genetic condition that is caused by abnormal cell division of a particular chromosome called the chromosome 21. My name is Dr. Martina Agbere, your regular host on this program, and I'm not alone. As usual, I'm with my very elegant co-hosts.
I remain Dr. Memuna Yusuf Kadri, and it's always a honor to be here because on your regular Health TV talk show, The Physicians, your health is always our business.
So we're talking about Down syndrome today, and it's something that people really don't know much about. They say the children, the people that actually have that kind of chromosomal abnormality, but they don't know the reason why it happens.
Yeah.
So, and for the public, there are so many myths around it. Some will tell you is what the mother did that resulted in her having that kind of child.
Yeah, the thing is that Down syndrome, because we are medics, we know it's a chromosomal abnormality. It's not like witchcraft. It's not like village people. It's not like it's what you ate. It's not like it's you stepped on something. All those myths that comes with because you are pregnant, you shouldn't go out in the midnight. It's because you saw a masquerade, or it's because you crossed gutter. Those kind of myths surrounding it. No.
So it will be the
yes, it will be a genetic disorder, and there's a particular chromosome that has been, pinned down on to say this is it. But the thing is that my concern with regards to children with Down syndrome, of course, which they turn to become adults, is the fact that they kind of look at them as if they are abnormal. Even in schools, there's that knowledge gap. Other children will laugh at them. Teachers will laugh at them. They'll be put aside. They'll be treating them in a way that there's something because of their facial and also it's really about enlightening the public and letting them know they are humans just like us.
I totally agree, they're human, and letting the public also know. But so that takes us back to knowledge. Most of the parents, most of them don't even know that these children are special. They have special needs.
Yeah.
And what other
learning disabilities,
stigma. Stigma still comes in here. Because they don't want people to see their children. They say just keep them indoors. And even lock them indoors.
Abandon them. So I strongly believe that if people are knowledgeable about what Down syndrome is, they shouldn't be ostracized.
Okay, if people are knowledgeable about what Down syndrome is, they shouldn't be ostracized. Well, we have an expert coming today to come and discuss this, and she's going to go deep and enlighten us when we come back for your regular program, The Physicians. Don't go away, just stay tuned. Welcome back. If you just joined us, you're on to your regular program, The Physicians, where your health is our business. Today we'll be talking about Down syndrome, a genetic disorder that is caused as a result of abnormality in a particular chromosome called the chromosome 21. And we have a guest in our studio who is to do justice to this particular topic. She is a consultant, pediatrician, she is a cardiologist, she's the MD, CEO, Excel Children Specialist Hospital here in Lagos. She's Dr. Chinyere Uzodinma. Doctor, you're welcome to our program.
Thank you.
You're welcome, Dr. Chinyere.
Very radiant. Nice. Where are the children? So let's just go on. We're talking about Down syndrome today. Do you want to just give us an overview? What is Down syndrome? What does it mean?
Okay. Excellent topic, and always an excellent time to talk about such an important condition. Down syndrome, spelled D-O-W-N, and syndrome, is also called trisomy 21. Now, trisomy 21 means that there is an abnormality at chromosome 21. So it's important for us to know that there are a pair of chromosomes for all of us we do have, and they are numbered. So at number 21, there's an abnormality that happens there. That abnormality means that an extra chromosome is at that position. And when you have an extra chromosome at that position, it actually translates to important manifestations, physical manifestations that you can see, and also manifestations that you will not be able to see but involve the different organs. And there are 3 distinct types of Down syndrome. You have the one that is called chromosomal non-disjunction, which is actually the commonest. About 95% of the cases are chromosomal non-disjunction. You'll get to find out the reason why we need to know the different types as we go into the discussion. The second type of Down syndrome is the translocation. The translocation accounts for about 3%, and then the last type is the one we call mosaic. Mosaic Down syndrome accounts for about 2% of the cases. So the commonest is chromosomal non-disjunction, and then you have the others. Now, when Down syndrome happens, the most important question that parents want to know is why?
Why?
Doctor, why do I have a child like this? But first of all, before I begin to explain why, I want to tell us that Down syndrome babies are very pleasant babies.
Yeah.
They are very happy babies to be around them. So when you have a Down's baby, it's not the end of the world. Enjoy your child. They're just special. So why do people have children with Down syndrome? Or specifically, why do these chromosomal abnormalities happen? Now, one, exact cause. I always want to start by saying cause effects may not be known, but there are risk factors. Now, there are risk factors, meaning that when this factor is present, the risk is higher. It doesn't translate to 1 + 1 = 2. Now, once this risk factor is there, it happens, no. But it increases the chances of having a child with Down syndrome. Actually, when you started, you talked about maternal age.
Yeah.
And truly, maternal age is one of the established risk factors.
Okay.
Remember, I said risk factors.
Yeah.
And before I go to the maternal age, I want to state that anybody, any age, can give birth to a child with Down syndrome. Even if the woman is 20 years old, can have a child with Down syndrome. I have seen that. So it's not just theory. However, when maternal age is 35 and above, the risk is higher. It's actually about 4 times higher risk of having a child with Down syndrome. So in the general population, age about 20 years, the chances is about 1 in 1,000. But when the maternal age is up to 35 or more, the chances increases to 1 in about 250 chances of having a child with Down syndrome. Now, what are the other important risk factors? If the parent has Down syndrome, they also have a higher chance.
Family history.
Exactly. So 60% chance that they will have a child with Down. If both of them are Downs, the chances of having Down syndrome
is
babies
higher.
also increase.
What do you mean both of them are Down?
If both parents are Down syndrome, the father has Down syndrome and the mother has Down syndrome. There are 3 features that are constant in children with Down syndrome. Like I said again, not the end of the world, but these babies actually come out with what medically we call global hypotonia. They are soft babies. So when you lift them, they just drop. Okay? It's constant. Most babies, all babies with Down syndrome will have that hypotonia. The second thing that is common with them is intellectual disability. So they're not the ones that are high flying. Okay? But like you were discussing before we started, they have a chance, to catch up on school at their own pace. Yes. And then the third constant feature is developmental delay. And when you talk about developmental delay, you talk about motor delay. Motor delay means delay in sitting down, crawling, and all that. They also have delay in cognitive development in terms of the time that they'll be able to do 1 + 1 = 2 and all that. And then also have delay in social development. In other words, when they speak, when they begin to talk, they also have a delay in that. These are constant features. Now, beyond that, there are things that we call phenotypic, facial features. So most of the times when you see them, they look somewhat peculiar face, They are beautiful, They have one peculiar face. But how do we recognize them? You see a child who has, I'll just go with the face and I'll just start with the
brow.
Exactly. So you see the eyes, they are outward slanting and upward slanting. So the eyes go like this. Upward and outward slanting of the eyes. Their nasal bridge is often flat. They often have a small mouth with a large tongue. So oftentimes you see them, their tongue is out, protruding. Yes. They often have what we call low set ears. So if you look at yourself, you find out that your ear, if you draw a line between the upper 1/3 and the lower 2/3 of your ear, that line is going to meet your eye by the side. But when it's Down syndrome, their ear is entirely under this line. So you say their ears are low set. When you also come to things like their fingers, their digits, they have short, fat fingers and digits. But these are physical features. Beyond that, remember I said this chromosomal abnormality affects the organs. Those ones are actually more important than these physical
ones.
So what are they? The most important of them is that they often tend to have heart problems. So 50% of children, there's a 50% chance that a child with Down syndrome will have an underlying heart problem.
Most times a hole in the heart.
Most times a hole in the heart, And then apart from that, they also have problems with their formation of the intestines. So oftentimes they have what we call duodenal atresia, an intestine that is blocked, that is not open. So that will also require some intervention immediately after birth.
So surgical
Intervention. Those have commonly what we call Hirschsprung's disease, a condition that is associated with not passing stool on time. It often begins with the baby has a delayed time in passing the first stool. But as they grow, you find out that these babies can stay for 1 week, no stool, 2 weeks, no stool, and their tummy will be big like this. An experienced doctor, physician, will always recognize a child with Down syndrome.
But the parents may not know.
The parents may not know. Sometimes I see mothers who are bringing their children at 8 months to the pediatrician, and that's the first time they are hearing that
Something has Down syndrome.
It's usually so devastating for them, because by then they've started asking questions. Why is my child not sitting? Why is my child not crawling? And then someone now says there's Down syndrome, didn't you know? But actually, the counseling should have started from birth. Yeah. Because as soon as you see the child, you know.
Okay, you said the counseling should have started from birth.
Yes.
2 things that I need you to talk about. Is it possible to know when a woman is pregnant, to know from scan if this child will come down with has Down syndrome, number 1? And number 2, we discussed this morning, and the way you also have the for genotypes, AS, SS, and if the parents, the carriers, and all those stuff. For this particular one, who is the person that is responsible? Is it the father or the mother? Who has that it comes from? Okay. This particular gene.
Okay, good question. So, your first question now. Prenatal diagnosis, very important. Prenatal diagnosis is very possible and is actually the gold standard. However, prenatal diagnosis tends to be reserved for those at very high risk.
Okay. So once we are like 35 years and above,
your doctor should advise you on prenatal diagnosis early, even though there's still an angle to it. Because the second angle is when you make a diagnosis prenatally.
What next?
What next? Exactly. And then you come to the issue of preserve life or not preserve life. But whichever the case, when you know, you are more prepared. You're better prepared.
Yeah. And the outcome is usually
exactly
better.
For the journey ahead. And how is prenatal diagnosis made? There is an ultrasound scan approach for prenatal diagnosis. There are also other tests, amniocentesis, that you can assay some levels of chemicals in the blood in order to identify whether there's Down syndrome or not. So the scan, the ultrasound scan is called nuchal translucency. It is done when the baby is in the womb, and it is usually done between 11 and 13 weeks.
So
very early.
The first 3 months of pregnancy.
Trimester. So it's like 2 months plus. That's when the scan is done, and they often check some things behind the neck of the baby, and they'll be able to say more than close to 90% sensitivity whether there's Down syndrome or not. Beyond that, there are also maternal biomarkers that you can do either in the first trimester or in the second trimester, but definitely before 16 weeks. You can do it at about 12 weeks. You can also do at about 16 weeks, depending.
We need to go out there and hear what our other people, viewers, are saying about what they're saying about Down syndrome. So when we come back, you are going to go more into how you are able to manage the patients and the family with it that comes down with Down syndrome.
Sure.
Don't go, we'll be back after the short break. Just stay tuned.
Okay, from a basic layman's term, Down syndrome is a psychological state where an individual basically loses his state of morality, his state of mind, state of consciousness, state of awareness, the ability for one to be able to reflect as a human being, the ability for one to be able to be motivated to push hard in life.
Well, I think it has to do with conception. At the level of conception, when the child is being formed in the womb, the child gets some level of chromosomes or genes that I think is more than is necessary.
Down syndrome is a disability that affects the brain and physicality of a child. The need for psychological awareness should be increased.
Well, the society can play the role of informing, creating awareness. There should be more awareness. So at the point of conception, when a woman notices changes in her body that she's pregnant, she can go for antenatals early. She can do medical checkup in time, so that if she's detected to have the child is if the condition is detected early enough, the doctors can come in to avert, the child being brought to life in that situation. Or
If you just joined us onto your regular program, The Physicians, where your health is our business, we're actually talking about Down syndrome, a disorder, a genetic disorder that affects a particular chromosome called chromosome 21. It's also known as trisomy. And Dr. Chinyere Uzodinma has been doing justice to this particular topic, and she's here been lecturing and tutoring us about Down syndrome. I'm sure you have actually benefited so much. So she also talked about how the risk factors of having a Down baby, syndrome baby, and she also talked about how one can actually detect during pregnancy and the time frame that one can actually do that investigation. So Dr. Chinyere, you just told us about that. How are you able to, as a consultant, pediatrician, I'm sure you come across these cases. I don't know how common it is, but for the ones that you have seen and the ones you are managing, how have you been able to cope with the patient, with the child, and the mother or the family, not the mother and the family? How have you been able to handle them? What are the challenges that you've seen in all these ones?
Okay, so again, that's a very good question. Working with families who have just had a child with Down syndrome can be challenging, but it's often rewarding when you help them to get above the situation to an extent. I think the greatest challenge is when the Down syndrome child also has a heart problem. So, because oftentimes when they have a heart problem, the commonest heart problem they have is what we call atrioventricular canal defect. It often requires surgery. So the greatest challenge is raising the fund for that surgery and coping with that heart problem. But in the absence of that, it's usually a smoother, journey. The second challenge is blame game. So like, who is the cause of this?
Yeah.
When the genetic problem is from the mother, the chances of the baby being Down is actually higher than when the father has the genetic problem.
Yeah.
So
it's
most of
important
the
to know.
time is the mother, more than the father. Yes. And remember, like I said, it's not just about the maternal age is one risk factor, but the mother housing the gene or the father housing the gene is a very important factor.
Is it even common two Down parents having marrying?
Well,
from your practice?
Yes, it is.
Really?
Yes.
In our client?
It happens, but not commonly.
Okay.
Actually, what happens commonly is people take advantage of
them, right?
of them and impregnate the female Down syndrome child.
Seriously?
Yes, yes. I have had a case like that before.
Who does that?
That's the place where we are. So because, like I said, they have intellectual disability. So sometimes people take advantage of that and impregnate the girl child. And then the girl gives birth to a child.
But what's the role of family in managing children with Down syndrome?
Thank you. Some people want to drop the child somewhere. In fact, a particular family had come to me and said, "Doctor, is there a place we can take this child to? Let the child live there." I said, "No."
So that's like abandonment.
Abandonment. And this is a child that is max maybe 1 year old. And they're asking. And I said, "No. I can only advise you about schooling." But the child will go to school and come back home. He will not stay there. So practically they want to see if there's a way to
You can just get rid of
the child, but that's not the way to go. And everybody who is listening to us now, I hope they can get that encouragement that all you need to do is seek advice from your healthcare provider about schools, education, where you can address the child's needs, special needs, so that they can learn. The good thing about Downs is that eventually they attain everything. Okay. So they're not working on time, they will walk. They're not talking, they will talk. They're not running, they will run.
It's just at their own pace.
At their own pace. There are two important things that the doctors must do. One, they need to screen for a heart problem. Because if they don't screen for a heart problem, the child may die
from that.
Late diagnosis. Secondly, they need to screen for hypothyroidism. Hypothyroidism is an endocrine problem. And when it happens together in a setting of Downs, it compromises their intellectual ability even further. So you want to give them the greatest chance to develop intellectually. So you want to make sure that their thyroid hormones are okay, and then they're able to, get to their fullest potential.
So thank you very much. But before we go, I want to just know this. How common? Is it more with the Caucasians or Africans?
It is possible that Africans will hide their children.
Yes,
it is possible that Africans will also put the child at a greater danger, so they die earlier.
Thank you very much again, Dr. Chinyere Uzodinma. You've actually done well, lecturing us, telling us about Down syndrome. I'm sure people out there, parents, everyone out there who has watched this program would actually attest to the fact that you have done very well and they have gained from this particular topic. So thank you so much for coming again on our program. And for our viewers out there, I'm sure you enjoyed today's episode on Down syndrome. They are human and you can live with them. They will definitely develop. The way you have developed, they will also develop. It may just take a while, it may just take a short while. But little by little, they will get there. They will go to school. They will do well in school. I've even seen some who are artists. I've seen some who are script writers. They do everything that you can do. Just that the developmental milestone is a bit slow. So let's give them the chance. Don't ever discriminate when you see Down syndrome individuals, because they are also very human. So on this note, I want to say thank you for being part of our program today. And same time next week, keep a date with us on your regular program, The Physicians, where your health is our business. I remain Dr. Martina Agbere.
My name remains Dr. Nomina Yusuf Kadri, and please don't forget to follow us on all our social media platforms. And if you want to be a part of the show, you are just a click away. Till next time, stay blessed.
My name is Sheon Dosumu, and I'm a staunch mental health advocate and the founder of a cross-all initiative for mental health and stigma eradication. I'm here at the Physicians show, the #1 leading show that talks about mental health and enhances mental health education. Continue to watch. I advise that everyone should tune in and watch this show.